Okay, so after reading my scenario, I'm going to proceed to approach my patient. Before doing so, I'm going to check that the scene is safe. I don't see any wires or spillages that may cause any slips or trips. So I'm happy to proceed. I'm going to close the door and draw the curtains around to provide privacy and dignity for my patient. And before approaching my patient, I'm going to do hand hygiene according to WHO standards. I'm going to apply gel on my hands. I'm going to rub my palms, back of the hands, fingers interlaced, fingers interlocked, thumbs in rotational motion, fingertips, and allow to dry for 20 to 30 seconds. Now that my hands are dry, I'm happy to approach my patient. So, hello, good morning. Marjorie, is it? Yes, my name is Aya. I'm going to be your nurse for this morning, and I'm here to do an A2E assessment, which is an airway, breathing, circulation, disability, and exposure assessment on you, as well as to check your vital signs, which includes your blood pressure, your temperature, your heart rate, respiratory rate, and oxygen saturation. But before doing that, I just want to confirm that I'm with the correct patient. May you please tell me your name and date of birth as I counter-check with your wristband and my documentation?
My name is Marjorie Ecclestone. The date of birth is 1/1/1939.
Perfect. So your hospital number is 123456X. I can confirm that I'm with the correct patient. I don't see a red wristband that you're wearing. I just want to confirm, are you allergic to any food, drug, or medication of any sort?
No, I'm not allergic to anything.
Thank you. That is confirmed in my documentation as well. So I can confirm that I'm indeed with the correct patient. So like I was mentioning earlier, I'm here to do your assessment. During the assessment, I'm going to have to be touching parts of your back, parts of your upper and lower arms. May I know if I have the consent to do this assessment?
I'm giving you my consent.
Perfect. Thank you so much. So I can see here that from your documentation that you've been presented to the emergency department after a fall at home and that you have sustained a head injury. How are you feeling?
I'm feeling I do have a severe headache, and I cannot remember anything that happened before.
Okay. So do you know where you are at the minute?
At the minute, no. I know I'm in my house.
Actually, Marjorie, I'm really sorry, but you're in the hospital. They've taken you to the neuro surgical assessment unit, and that's where we are right now. So don't worry, I'll keep reorienting you if this happens frequently. Is this a new thing for you, or is this an old thing?
No, this is quite a new thing.
Okay, so don't worry, I will be reassuring you. I'll keep reorienting you. So I'm going back to your pain that you complained earlier. I'm really sorry that you've had pain, and I can see that you haven't had any medication from your documentation. So I just want to know whereabouts is the pain?
Pain here, it's in my
Okay,
head.
so it's all over your head.
Yes.
So if you were to score it, Marjorie, from a 0 to a 10, 0 being no pain and 10 being the worst pain, how would you score your pain?
It's most likely 8 out of 10.
Okay, I'm really sorry. That's a lot of pain that you must be feeling. Is there anything else I can do to help you while I'm here? Do you want me to reassist you in a comfortable position?
Yes, please.
Right, so I'm just gonna set this down. Okay, so do you want me to rearrange your pillow?
If you could lift it up, please.
Okay. Does that make it a little bit better?
Yes.
Perfect. So I'm just gonna do my hand hygiene. Right, Marjorie, is your pain any better?
Yes, it's lessened a bit.
Perfect. So what I'm gonna do is I'm gonna check later on if I can see any medication prescribed for you per pain, and then I'll administer that right away. Right? Meantime, you can use your call bell. I'm just going to put my apron and my gloves so I can proceed with the assessment if that's okay.
Yes.
Perfect. Okay? So I'm going to do hand hygiene again. Okay, allow my hands to dry for 20 to 30 seconds. And then I'm going to put my apron on first. So while I'm putting my PPE on, so Marjorie, since I'm in the room anyway, and you've mentioned to me that you don't exactly remember where you are, can I ask you, do you know what the date today is?
The date today is 16th of January 2024.
Okay, perfect. You have the correct date. It is the 16th of January 2024. Do you know what time it is?
It's in
right? So I'm really sorry. So along with your disorientation to place, you're also a little bit disoriented with time. So the time this morning is 10 o'clock. So don't worry, I appreciate there are no windows here, but I will keep reorienting you all throughout, okay?
Okay.
Right.
Thank you for that.
So how is your pain again? Is it a little bit better?
Yes, it came down to maybe 7. Yes.
Okay, that's good. It's a little bit better, but don't worry, I will keep checking and reassessing all throughout. Right? So, like I mentioned earlier, I'm going to do your assessment, your ABCDE, and your vital signs. So, because I've already checked that my equipment has been cleaned and calibrated for the last 24 hours, I'm happy to proceed with using them, and I'm going to begin with your blood pressure first, okay? So, I can see from your past medical history, you've had a previous right-sided CVA. Do you have any weakness on a certain side of your body that I should be aware?
Actually, my left side of the body has mild weakness.
Okay. So if that's the case, I'm gonna use your right arm, okay? So because I cannot see any cannulas in that arm as well, and it's unclear with your sleeves on, would you be able to tell me if you've had any surgeries to that arm prior?
No, I didn't have any surgeries.
Perfect. So this should work. You should feel a little bit of tightness when I put this cuff around you and when I start the machine, but I've used an appropriate cuff for you. So what I'm going to do is I'm going to place this um, 80% covering your arm above the antecubital fossa and making sure that it's not too tight or too loose. Is that okay?
That's okay.
Yes, you can relax your arm. Once I start the machine, you will feel a little bit of tightness, but don't worry, it will go away shortly. So starting the machine. And while that's running, Marjorie, I'm going to go over to your other side and I'm going to check your pulse rate if that's okay, okay? So checking your pulse rate, I will need to be silent for 1 minute. I would appreciate it if you do the same, okay? I'm going to do it for another minute just to recheck your pulse rate and then I will tell you what the results are. Okay? So my 1 minute starts now. Okay, thank you, Marjorie. I've checked your pulse rate. It's actually 70 beats per minute, which is in the normal range. So what I'm going to do is I'm going to cross your arms over your chest and I'm going to recheck that again if that's okay. Again, I will be silent as well. So my 1 minute starts now. Thank you, Marjorie. Second minute is done. So I'm really sorry I didn't inform you earlier, but what I actually was doing in the second minute was I was checking your respiratory rate because usually when we tell our patients, the results get altered. So I hope you didn't mind. But your respiratory rate was 18. It's got a good rhythm and depth as well. So no need to worry about anything, okay? So I've checked that your blood pressure has finished reading, so I'm going to go around and remove that cuff and tell you what your results are. Okay? So I can check that your results are 107/69, and that is a little bit low, but it's still within range. So I'd like to know, do you feel a little bit lightheaded at all, or have you had anything to drink earlier?
For the drink, I haven't drank anything yet.
Okay,
It's
so
not really lightheaded. It's just a severe headache.
okay. So I will double check with your records if that's your within normal range. But from my documentation here, it shows that you normally have hypertension. So I will query that with the doctors and I will check if I can give you something to drink or if we can reposition you so that we can improve your blood pressure a little bit. But if you feel lightheaded at all, please let me know. Okay? So I've done your blood pressure and I've done your pulse rate and respiratory rate. What I'm gonna check next is your temperature. Is that okay? Right, so I'm going to be using this thermometer and actually, I've got the pulse oximeter here with me. So what I'm going to do is I'm going to be putting this as well on one of your fingers. It's just going to check your oxygen levels in your blood. It's not going to be painful at all, okay? Would you be giving me one of your fingers or you don't mind? Okay, so I'm going to check. So I don't see any nail varnish present and there's no discoloration and no signs of infection at all. So I'm happy to use your index finger here. So what I'm going to do is I'm going to turn this on and I'm going to place your finger there and I'm going to wait for the results to come. And while we're doing that, I'm going to use this infrared thermometer. So I've turned it on. What I'm gonna do is I'm gonna point this on your forehead. It shouldn't hurt at all. You will hear a beep. All you need to do is concentrate on me and look at my forehead, okay? So right, I'm pointing it. Your forehead is clean, right? No signs of inflammation and infection, so I'm happy to use it. Okay, so your temperature is 36.8, which is actually normal. So your normal temperature should be within 36.5 to 37.5. So I'm happy with that. And while I've use that thermometer, I can also check that your oxygen saturation is 99% on room air, which is actually really good as well. So everything is within range, so I'm happy for that. But before I leave your bedside to document everything else, because you've sustained a fall and had a head injury at home, I'm going to be doing a few additional checks if you don't mind. But I'm going to be walking through it. I know that you were in pain earlier. Is your pain still okay? Would you still like me to continue?
Yes.
Perfect. So I've got here a pen torch. So what I'm gonna do is I'm gonna shine this pen torch in one of your eyes, one at a time. I will be shining it from outer to inner canthus, but because you have your left-sided weakness, I might assist you with your left hand covering your left eye. Is that okay? Perfect. So when you're ready, I want you to just concentrate on me and look into my forehead as I shine the light, okay? Are you able to cover your right eye for me with your right hand? Okay. Right, so I'm going to shine it from your left, from outer to inner canthus, and I can see that your pupillary action is brisk and it's size 3, right? So I'm going to go and do it again on the other side, okay? So I'm going to be covering your left eye, and again, just look at my forehead. Okay, so your pupillary reaction as well is brisk and it is also a size 3. So they're both equally reactive to light, so that's really good. And then finally, because I need to check your limb movements, I will need to ask you to raise your hands or your arms rather and your legs. So are you able, which side are you able to swing over so it's comfortable for you so that your legs are dangling?
I could swing on this side.
That's fine. Would you like me to assist you?
I can manage.
Okay, thank you. Right, Marjorie. So what I'm just gonna ask you to do is just follow my instructions. Are you able to lift both of your arms for me like this? Perfect. So I can see that there's a little bit of weakness, or this side is a little bit lower than the other one. Are you able to clench your fists for me? Okay, the same. So what I'm going to do next is I'm going to be applying pressure on both of your arms. I want you to try and resist them, okay? So putting pressure, I can see that there is a little bit of weakness on your left side. So thank you for that. What I'm going to be doing is I'm going to be doing them both for your legs as well, okay? So are you able to raise both of your legs for me? Is that comfortable for you? Okay. So again, I'm going to put pressure. Try to resist. Right. I can feel that there is a little bit of mild weakness on your left side. So thank you very much for your cooperation, Marjorie. Would you like me to assist you back into your position?
I think I can manage.
Okay. Perfect. So Marjorie, what I'm going to do is I'm going to proceed now to my ABCDE assessment as I have done through your vital signs. And then later on, I will be documenting them, okay? So are we comfortable? Yes. Would you like me to adjust your pillow?
Yes, a bit.
There you go. So I'm going to start with airway. So for airway, I want you to kindly open your mouth for me. Right? I can see that there are no visual obstructions. Are you able to cough for me? Okay, so the cough is clear. It denotes no visual obstruction, so I can declare that your airway is clear. So I'm going to move on to breathing, okay? So for breathing, I've already checked your respiratory rate earlier, and it was 18. It had a good rhythm and depth to it, so that is fine. I've checked your oxygen saturations. They were 99% on room air, which is also normal, okay? Right now that as I'm talking to you, I don't hear any respiratory noises, such as rattle, stridor, and wheezing, as well as coughing. So I'm happy to proceed. I don't also see any visual signs of respiratory distress, such as seesaw breathing, use of accessory muscle cyanosis, or sweating. Just need to check your air entry. I'm just gonna ask you slightly to turn whichever way is comfortable for you, and I'm just gonna be putting both of my arms on your back, and I'm gonna ask you to inhale and exhale, okay?
Okay.
Okay. There we go. Are you still okay? Yes, so I'm going to be placing my hands on your back. Can you inhale for me? Exhale. Okay, I'm going to do it again. Inhale. Exhale. Thank you so much, Marjorie. So let me assist you back into position. So I can confirm that your air entry is equal. Okay, so I'm done with my airway and breathing, so I'm gonna proceed next to circulation. So earlier when I was checking your heart rate, it was 70 beats per minute with good rhythm and strength, so that was actually really good. I've also checked your blood pressure. It was a little bit lower to our liking. It was 107/69, but don't worry, I will double check that with the doctor. I'm gonna check your capillary refill, okay? So this will just entail me pressing onto your one of your fingers on the nail bed for no longer than 5 seconds to see if the color returns back right away. Is that okay? Perfect. So I'm gonna use the same finger. So I'm gonna press your nail bed gently for 5 seconds. So 5, 4, 3, 2, 1. And I can see that the color came back in less than 2 seconds. So your capillary refill is actually really good. So I've mentioned earlier signs of paleness. So I don't see any signs of paleness at all, as earlier your fingernails were pink and the color came back right away. But another way to confirm that is, are you able to show me your palms? Right? So I can see that they're both red and they look well perfused. So there are no signs of paleness at all. And while I was touching your upper and lower limbs, they were warm to touch. So I can confirm that your perfusion is also good. Okay, so I think that covers pretty much of the circulation. So I'm going to move on to disability. So earlier, when I was asking you the questions, I was asking you where you were, if you remembered what time it was and what place it was. So I can confirm that because you are, your eyes are open and that you're talking to me and you're looking at me directly, you are alert. But there is a little bit of disorientation there in terms of the place and time, which I will reassure you that I will keep reorienting you. I've asked earlier if this is a new thing, and you've mentioned that it is actually a new thing. So I'm really sorry, but it could be possibly because of the head injury that you sustained in your fall. But we will keep reorienting you, and there's nothing to worry about. You're in the right place for the monitoring, okay? Okay, so moving forward to disability, I know that you were in pain earlier, so I just wanna check again. Do you still have that pain? Is it the same intensity?
Yes, it's with the same intensity.
So
It's
is it,
still the headache.
it's still the headache. Are you still okay for me to proceed with this?
Yes, you may proceed.
Okay, so thank you for allowing me to do that. I'm gonna ask you just a few more questions if you kindly bear with me. So I want to know, are there any changes to your urine output that you may be aware of, or your bowel movement?
No, it's still the same normal.
Okay, so no color changes, no pain at all when urinating. And moving your bowels, have you moved your bowels today?
Yes, I move once a day regularly.
Okay, so that's your regular bowel movement. Finally, for disability, I just want to know, has somebody checked your blood sugar?
No.
No. So this is one member of staff approaching you and pricking your finger. Usually, they've got a machine to read your blood sugar. So can I confirm that nobody has checked it?
No.
Right, so we're done with disability, and finally we're gonna head to exposure. So for exposure, I checked your temperature earlier. It was 36.8, which is within normal range. I couldn't see any signs of bleeds, rashes, injuries, or bruises earlier when I was checking you physically. But are you aware of any of this that you should need to report to me at all?
No.
Perfect. Okay. So that concludes it. I will just go around so I can see my documentation. I'll just need to confirm some of your medical history if that's fine. Okay. So Marjorie, earlier, you've confirmed to me that you've got a previous right-sided CVA, which the effects have resolved, which includes your left-sided mild weakness that I have note. I can see that you've got hypertension noted here as well, and you've got atrial fibrillation. You've got a history of falls, is that correct?
That's correct.
Okay, and you've also got a past medical history of dementia. So I know it's a little bit difficult with you being in a different place or different area, but do you think there are any more medical histories that I should be aware of that you know about?
I think that's all.
Thank you for your cooperation, Marjorie. So what I'm gonna do is I'm gonna be in a separate side of the room. I'm going to be documenting all the things that I've done here and all of the things that you've shared with me. I know that you're in pain, so please bear in mind you've got your call bell next to you. Should the pain become really unbearable, please don't forget to press the button. Somebody will be attending you shortly, okay? Perfect. Thank you so much again, Marjorie. So I'm going to leave my patient's room. Before doing that, I'm going to remove my PPE. So I'm going to remove my apron first. And I'm going to put this in the clinical waste bin. I'm going to dispose of my gloves. And I'm going to do hand hygiene according to WHO standards, palm to palms, and allow to dry for 20 to 30 seconds before proceeding to document. Right, so now that I'm ready to document, I will first make sure that there are no other blanks here needing my candidate name. Because there are none, I'm going to proceed to my patient's neurovital signs documentation. I'm going to start documenting from left to right, top to bottom, starting from patient's name down to initials. So at this point, if all values are inside the table, there should be 27 values inside your table when you complete. I'm going to start with patient's name. So it's Marjorie Ecclestone. Her hospital number is 12345 6X, and the date today is the 16th of January 2024. Date of birth refers to your patient's date of birth, which is 1/1/1939. And the time is the time of your scenario, which is 10 o'clock in the morning. So because my patient's eyes were opening and they were spontaneous when I was talking to her, I'm going to score that as a 4. Verbal response, she was confused with some of the little things, and she said that it was something that is not baseline, or that's something that's new to her. So I'm going to score her 4 for confused. Best motor response is for all of my instructions, she was obeying all my commands. So I'm going to score that as 6. Her temperature was 36.8. So I'm going to put a dot next to the box of 36 and I will put my value there, 36.8. Her blood pressure was 107/69. So I'm going to place it in the box next to 100 because that's what where it should comprise for that systolic, 107/69. So 69 should be in the box next to 60, and connect them with a broken dotted line. Her pulse rate was 70, so don't miss writing that. It's in between your blood pressure reading. Respirations were 18, so just add the value. Oxygen saturations were 99% on room air. And your pupillary reaction on the right and left, the size were both 3. And the reaction, your legend, is located on the right hand side of your document. So because it was equally reactive, I'm going to write the plus or positive sign underneath those or inside those boxes. For the limb movement, for the arms, for normal power, I would label it R for right. Mild weakness would be L for left. For the legs, it will be the same. Normal power for the right and mild weakness on the left. So again, another R to L. If both limbs are or have normal power, you can just write R/L on the box that it is supposed to be written in. So because the patient has scored 4 for eye opening, 4 for verbal response, and 6 for motor response, her GCS score is 14 out of 15. So I will write that there. And my initials, my name is Aya Cruz, so I will put AC at the bottom. So this is how it should look like. So after ensuring that I've completed all of my documentation that I need, so I'm gonna do, again, hand hygiene, palm to palm, back of the hands. Fingertips, and allow to dry for 20 to 30 seconds before approaching my patient. So now that my hands are dry, I'm happy to approach my patient. Hello, Marjorie, I'm back. I've managed to document all of your vital signs and all of the things that I've done for your assessment. So I have noted earlier that all of your vital signs are within range except for your blood pressure, which is a little bit low. But more importantly, your Glasgow Coma scale or your GCS score is 14/15. It's most likely because you've had a fall and you were a little bit confused in answering me with regards to time and place. Okay, so we're gonna have to monitor you every 30 minutes for 2 hours, hourly for 4 hours, and then 2 hourly thereafter, or until your clinical condition changes. It's just because with the nature of what happened to you before coming into hospital, we want to know that we will be monitoring you regularly. Is that okay?
That's okay.
Perfect. Am I still okay to ask you several questions before I proceed?
Actually, this is taking too long. Why is that?
I'm really sorry, Marjorie. I know that it must be inconvenient, especially now that you're in pain. However, we need to ask you these questions so that we can better develop a plan of care for you. Is it okay for you to cooperate with us just for a little bit?
Please make it fast.
I will try my best. Thank you so much. Okay, so I'm just going to proceed. I've got your documentation here. So you've confirmed your past medical history earlier, and you mentioned earlier you can't remember why you were admitted to hospital because of the fall. Is this still the case? Do you still not remember why you're here?
Yes, that's the case, yes.
Okay, so I can find here that you're also normally walking with a walking frame at home. Um, I think it's perhaps of your left-sided weaknesses. Am I correct with that?
Correct.
Okay, but are you able to walk around the bed, or what distances are you able to walk without a walking frame?
Without a walking frame, just maybe around the bed.
Okay, so I would highly suggest that you would use a call bell when you need to mobilize. Meantime, while we're arranging things for you, I'm going to liaise with the occupational health therapists so that they can provide you with mobility aids so that you will be able to mobilize safely. Okay, is that fine? Right. So, by the way, you've mentioned earlier about your headache. How is your headache feeling? Is the pain still there?
It's still there. It's still severe headache.
Okay, so is it still the same pain score, 7 out of 10?
Yes.
Okay, so I'm really sorry. I do appreciate you're in pain. Like I said, I will try to make this as quick as I can. Okay, so I can also see that you live with your husband in a two-story house. Does he know that you are here?
Yes, he knows about.
Okay, can I ask you, is he your next of kin, and will you allow me to let him know how you are doing here in hospital?
Actually, I do also have a daughter with us, but she does not live in our house. She lives maybe 2 blocks away from us. She usually visits. Her name is Rachel.
Okay, so
Maybe you can tell Rachel about my condition.
that's fine. If you will allow that, I would gladly do that for you. I can see here that your daughter's name is indeed Rachel, so I will update her as long as you allow me to. So they've also mentioned that you've got a package of care twice a day for activities of daily living. So may I know what kind of things around the house do you usually need help with?
You know what? With my medications.
Mm-hmm.
In fact, I brought it with me here.
Okay, can I see?
And I just remembered that
You've dropped something?
Oh yes, that's my glasses.
Right,
So,
I can
I don't
see.
know where would I put it. So sorry about that.
That's okay. So, are these glasses prescription or reading?
It's just for reading mainly.
Okay, so for reading, I would normally just keep it next to you so that you can see it, so that when you need to use it, it's easily accessible for you. Okay. For your medication.
Yes, you know what, nurse?
Mm-hmm.
I just remembered I need to take this blood thinner medication with me.
Okay.
Here. I need to take them now.
Right. Okay. I'm sorry, Marjorie. I know that you normally take this at home, but I think what would be safe is we'll just keep this in a locked cupboard first. I won't take them away from you or dispose them. I'll just keep them in a locked cupboard because there's sometimes when you take medication at home and when you're admitted to hospital, the doctors might want to change some of the frequency or some of the doses. So I just want to make sure that we're ensuring that you're taking the safe or the right amount of medication. Is that okay?
Are you sure you're giving me my medications at the correct timing?
Yes, I will try my best to do that. And if ever we are off the timing a little bit, maybe, or if they remove one of the medications from your prescription, we will let you know. It's always with your consent, okay?
Okay, just make sure it's safe.
Okay, don't worry, I will. make sure that it is safe. So I'm just gonna keep hold of this for a bit, and then I will return them to you on your discharge or keep them in a locked cupboard for now, okay?
Okay.
Right. So are we still okay to ask several questions?
Yes.
Yes, okay. So other than that, I can see that you also have meals delivered on wheels. Do you have a preference for food or diet or
Actually, I do just take some normal diet and I usually prefer meat.
okay, so meat. Don't worry, I will make note of that so that all people helping you with your food will be aware of that as well. So I can see here that they've noted that you like to drink alcohol.
That's correct. I really like to drink.
Okay, so with you being in hospital, I don't think you will be able to drink as much alcohol as you would normally do when you're
Why?
at home.
Do you not serve alcohol here?
No, I'm sorry, I'm afraid we don't serve alcohol here, but have you ever considered talking to somebody or about your alcohol intake? Is it an excessive thing or is it something that you just enjoy occasionally?
I just do enjoy drinking.
Okay. So if ever you feel that you want to gradually stop your drinking of alcohol, I can refer you to our alcohol liaison officer, but only with your consent. So just let me know, okay? I can also provide you information leaflet for that.
Okay.
Okay? So I think most of the questions that I've asked are have already been answered. Is there anything else that you would like to raise to me that I haven't asked you at all?
I think you already covered everything.
Okay, so again, thank you so much, Marjorie, for your cooperation. I know we've done or we've asked a lot from you today, and I that you're still in pain. But don't worry, like I said, this assessment is done. I will make sure that I will talk to your doctors to see what we can give you for your pain. Meantime, while I'm sorting that, if you need a hand with anything, please don't hesitate to use your call bell, okay?
Okay.
Perfect. So since the procedure is already done, I've documented everything that I need to document. I will ensure that all of the equipment that I've used have been disposed of properly in the proper waste bins allocated, and that the equipment that I've used will be cleaned, ready for next use. Okay? Since I've assured that that's already done, what I'm going to do is I'm going to end my station by following WHO standards. So I'm going to again apply gel on my hands, and I'm going to do palm to palm, back of the hand, dips, and allow to dry for 20 to 30 seconds.